Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing 4 additional deaths due to COVID-19, and I'd like to extend my condolences to their family and friends and loved ones. Our current 5-day COVID-19 test positivity rate is 11.6% provincially, 13.8% in Winnipeg. 502 new cases of the virus have been identified as of 9:30 a.m. This morning, bringing our total number of lab-confirmed cases in Manitoba to 42,453. This increase in the cases means that our public health nurses and contact tracers have been quite busy. They've shared a lot of information with us where they feel there's significant risk of transmission occurring. They're seeing, in many situations, household members who are symptomatic seeking testing. However, the rest of the household is not isolating pending results of those tests. So we're seeing positive tests home. Positive tests eventually come back where people in that household have been at work and had been at school or out and about, and later they have turned positive. So a lot of avoidable contacts there. So again, people who are symptomatic, we want you to be tested as soon as possible. We want you to isolate pending results, but we want everyone in that household to be isolating pending the results of that individual. We can avoid a lot of unnecessary contacts in the community by doing this. And so that, to be clear, that means not going to work or to school or to childcare. It means not going shopping. We want that whole household to isolate pending results. We've seen too many examples of unnecessary contacts with this. We're also hearing from the public health nurses that people are being more and more reluctant to share information with them. So they're not being forthcoming with where they had been and what contacts they may have had. And so obviously this limits our ability to track down contacts and have them isolate to stop those transmission chains. So we are really asking people to be very forthcoming with where you had been and what contacts you may have been around. Again, as we're doing contact investigations, you don't need to worry about this being reported to enforcement officials. We're just doing a contact investigation so that we can notify your contacts, so that we can get them isolated and tested if necessary. So there's no reason to withhold that information. Please be forthcoming with the public health nurses. We're trying to end these transmission chains. Since last Friday, we've had more than 1,500 cases reported, and that's why we had to take stronger public health action. That's why we had to move Winnipeg and Brandon schools to remote learning. That's why we're asking Manitobans to stay home. You know, the best way to limit the amount of contacts outside of your household is to stay home. And so really go out for essential reasons, limit those contacts outside of your household, and it's the best way that we can end these transmission chains. So we're all tired of this pandemic. We're tired of these restrictions, we're tired of not doing the things we love and need to do, tired of not seeing family and friends. But we saw in February and March of this year these measures work, and we need them to work again. This time, though, as we're implementing these public health measures, we have increasing vaccinations occurring. With every passing day, more and more Manitobans are protected. So this time, as we implement these public health measures, these public health restrictions, at the same time, each and every day, we're closer and closer to having Manitobans protected from this virus. Starting today, those aged 30 and over are eligible. So I really encourage all Manitobans to book your appointment, to be vaccinated as soon as you become eligible. It really is our pathway out of these restrictions. Please stay home as much as possible, reduce your contacts outside your household, get vaccinated as soon as possible. And thanks again to Manitobans. It's been such a challenging 15 months, but these vaccinations are really our pathway out of this. So thanks again, and happy to take some questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from the Brandon Sun, Kim.
Good afternoon, Dr. Roussin. My question today is with critical service workers, I understand that they're still permitted to bring their children to school. Are the teachers and substitute teachers who are still working able to access the vaccine sooner as a result?
So right now we're 30 plus for the vaccine eligibility, and in the hotspots, then we know teachers and childcare workers are eligible down to age 18. So there hasn't been a change otherwise in vaccine eligibility. So I'd encourage everyone to take advantage of their eligibility as soon as they can.
Thank you for that. My second question is, and I apologize if this has already been asked before in the past, but do you know how long it takes being exposed to a variant of concern before we can expect to contract it? I know that's kind of an elusive question, but I am curious.
This is the incubation period, as we call it, and so it's typically 2 to 14 days for COVID-19. Where the majority of people around that 7 day, and it's diminishing after that. So anywhere between that 2 to 14 days is the incubation period.
From CJOB, Skylar.
Hi, Dr. Roussin. Before I get to my question, I just want to congratulate you on being named Physician of the Year by Doctors Manitoba. We saw that news this morning. I just have a question about the sequence of events the last few days. Did the fact that you were in court speaking about health orders while some groups challenged them have any effect on the delayed rollout for the school closures over the rest of the restrictions you talked about on Friday?
Health orders based on the epidemiology and trying to find that balance. We know that the restrictions themselves have important effects on health, but we know this virus has the potential to overwhelm our healthcare system, thus affecting not only COVID patients but non-COVID patients, and we're seeing that again in our healthcare system. So it's entirely based on the trends that we're seeing.
Thank you for that. My second question is, do we have any stats on how many people are getting COVID-19 after the 2 weeks have passed from their first dose, and maybe how many people are getting that virus before that 2-week gestation period has passed when they get that first jab?
Yeah, so typically we're seeing to get that protection from the vaccine, it takes that 2 to 3 weeks from it. So when we look at the amount of what we'd call breakthrough infections after that first 2 weeks, we're seeing it very, very minimal amount of these cases. We are going to be reporting some of the very specifics to it. But if you look at the breakthrough cases, we're seeing certainly the minority of new cases are in those who have been vaccinated and the duration of protection, and then even fewer that require that have severe outcomes. So we're going to start looking at ways we can present that, because it's very clear that the vaccine is protective, and you can see it in our healthcare system with people admitted to hospital. We're seeing less and less of the older age groups admitted to hospital, and that's very likely due to the large vaccine uptake in the larger age groups.
From the Winnipeg Sun, Glenn.
Yes, Glenn Dawkins from the Winnipeg Sun. Good afternoon, Dr. Roussin. When you were talking about the public health nurses, there being some reticence from people to be forthcoming about their exposures. 15 months into this, is that a surprising thing, or are they attributing it to just sort of that fear of enforcement, or it would seem that at this point this would be a fairly pro forma thing, that people would get into, but obviously it is not.
We've seen issues with it throughout the pandemic, but we're seeing it growing and growing now, the issues with it. And so, it's hard to know what it's attributed to. We want to make it clear that you don't need to worry about the enforcement. We're just doing a contact investigation. We need to know this. It's not going to end up in us reporting you to anyone. But a lot of it has to do with the fatigue. We're 15 months into it. I think a lot of people are very tired with this. But we do need to hang in there. These contact investigations are very important to ending transmission chains. So we're really requesting Manitobans be very forthcoming with the public health nurses. They're not looking to report you to anyone. We just need to be able to track down those contacts.
As you said, we've had 1,500 or over 1,500 cases since Friday. Obviously, the numbers are going in the wrong direction. Is that cause for concern that we're seeing the tip of the iceberg here?
Well, it was certainly a cause for concern, and that's why we needed to put in those tighter measures that took effect yesterday, and then sending the schools to remote learning in Winnipeg and Brandon. So it was concerning enough that we had to take even more restrictive means. So, we can expect that these numbers will continue to climb for the next week or so, next week or two. And then we're going to start seeing the benefits of these restrictions. So, in the meantime, we need Manitobans to, follow these orders, follow the spirit of the orders. Really look for ways that you can reduce the amount of contacts you have outside your household. Get tested as soon as you become symptomatic and isolate. And again, if you're symptomatic and going for testing, ensure everyone in your household is isolating pending those results.
From CBC Radio Canada, Alexia.
Good afternoon, Dr. Roussin. Can you provide us some information, some details on the spreading of the Indian variant since the first cases appeared in Manitoba last week?
Yeah, and so this variant right now is a variant of interest. It's and so we're following it, as close as we can. We don't screen for it at this point. We're getting sequencing done and targeting sequencing. So again, we're following those numbers. We haven't seen a lot of transmission that we've detected with this variant. So we've seen, most of the cases related to international travel and then spread within households. But we'll be watching it quite closely.
Thank you. And I was wondering why the current measures are not in place until the end of June, since there will be more people vaccinated at this time.
Yeah, and it's again, we're not going to make any moves on these restrictions without considering where we are at with vaccinations and with our epidemiology. So like usual, we put these in for a period of time to give us that real hard reset to review where we're at. If they need to be extended, then we will do that. But we are, considering a significant amount of Manitobans protected by the end of May. So we really wanted to have that opportunity to review things very closely to see if there's any chances to loosen some of these restrictions at that point.
From CBC Manitoba, Bart.
Hi, Dr. Roussin. The World Health Organization now says that B167 subtype 0.2 is now a variant of concern. The B1617 cases in Manitoba, which subtype are they? And now that it's the VOC, how, if any, does that change our epidemiology?
Yeah, and so we're looking at ways to be able to test for this quicker. Right now, we're relying on sequencing. Right now, we really are treating all cases as if they're a variant of concern. We have very strict contact guidelines. And so we're really treating all cases as variants of concern. So it doesn't really change our approach to it. And so we'll be working with the lab to be able to, more quickly identify this. But as far as seeing that here, of course, it's added concern. to us, and we're seeing the spread right now predominantly of the B117. But we'll be following this one closely. But right now, if you're a case in Manitoba, the case and contact investigation is being taken out as if you are a variant of concern.
Thanks for that. Doctor, last week we reported on a slide that came out of your modeling that showed that we could get to approximately 60 COVID patients in ICU by May 23rd. It's May 10th, and we're at 60 COVID patients in ICU. Where does your modeling say our case counts could be, in what range? I know they're not predictions, they're projections with a range. Where do you think our case counts could be by the end of Victoria Day?
Yeah, it's difficult to know. We have that modeling, and actually we're going to try to release details of that. I don't have a specific date, so I don't. You're right. It is a range, and of course, and then it's a range of scenarios. And so that's one of the challenges with modeling is that it presents us with a number of scenarios. It doesn't tell us where these new restrictions put us on which scenario. So it's a very big range. So what we're looking at right now is that modeling showed where the trajectory that we were on was going to put significant strain, and already is, on ICU and increasing case counts. It doesn't tell us where these new restrictions put us. So it's very hard to say where we're going to be at by May 23rd, but we're going to try to present that clearly with some of those questions, and I hope in short order.
From the Canadian Press, Kelly.
Hi. So Premier Pallister mentioned earlier today that the province is looking at a roadmap of the pandemic, or out of the pandemic, similar to Saskatchewan. So what key indicators do you think need to be included in any kind of map, hospitalizations, vaccinations, or other things?
Right. So, so certainly vaccinations. So we're going to have some connection with this reopening to vaccine rates, both first and second doses. But we can't rely exclusively on that. We're going to have things tied on there related to hospital capacity and demand, as well as our epidemiology. So this is something that we're working on right now. I think the vaccine uptake, it's going to be much similar to the things you're seeing in Saskatchewan along those lines. But in addition to that, we're going to have some indicators that relate to the epidemiology we're seeing.
And you spoke a bit earlier about some of the risky behavior that's taking place that you're hearing from public health nurses. So can you provide some more examples or trends that you're seeing, and how Manitoba's numbers were really able to grow so much so fast?
Yeah, and so I think, again, it's not singling out anyone. I think people are tired, and when we are able to loosen some of the restrictions with our numbers, it's very easy to try to get back to normal. And so what we saw was a lot of social gatherings within households on private property, a fairly large number of gatherings. We were seeing, like I mentioned, people who are ill going for testing, but while they're waiting test results, their family members who are high-risk contacts have been out and about at school, at work, at other gatherings, and then started larger transmission chains. And so those were things that could be avoidable. We saw lots of examples of people with mild symptoms who didn't go for testing and got better after a couple days, only to go out and actually still be infectious. So again, we talk about some people can have very mild symptoms, especially at first. Any symptoms, even if you're not sure, get tested, isolate pending those results, because we've seen a lot of transmission chains that could be avoided with following this type of advice.
From CTV Winnipeg, Jeff.
Hi, Dr. Roussin. I'm wondering if you and other officials have said that transmission in schools, it's really, while the cases are connected to schools, a lot of the transmission is outside of the school. Was there any consideration, and why not, to a more targeted approach for remote learning instead of going, all of Winnipeg, all of Brandon?
And so for sure, we consider a lot of scenarios when we're looking at these things. So we looked at certainly a targeted approach. We looked at province-wide approach to schools, and then we ended up with the sort of the combined approach with it. So it was like we were saying that 75% of the effective schools were in Winnipeg and Brandon. We already had a number of schools in those areas that were on remote learning. And then we know that there is going to be, that there is a lot of community transmission and very much growing cases within those younger cohorts. And so we're going to see more and more schools in very short order need to go to remote learning, even with that targeted approach. So we wanted to be proactive, have some certainty, really have this circuit break right now, especially in Winnipeg and Brandon. And so that's why we landed on that.
And I know you've already touched on this with vaccines, and we've got to give it some time to see what the restrictions accomplish. But looking back at the second wave, it took us almost 3 months just to start to lax the public health rules. And I mean, parents are probably sitting here today thinking 3 weeks is maybe optimistic. Should they be preparing for the entire school year is gone, because June 30th is not that far away? I think there's a lot of parents who want to know that today, Dr. Roussin. What can you tell them?
Yeah, and it's we unfortunately can't give that degree of certainty right now. We've put this circuit breaker in. We know we have vaccines working for us. We know that very likely we have the nicer weather working for us. But we're going to reassess by the 30th. Right now, that was the plan, was to still salvage some of the school year, and we're going to continue to try to do that. There could be the possibility that our transmission is still quite high at that point, and we'll have to rethink that. But for right now, we need to focus our attention on following these health orders. We need people to get vaccinated as soon as they can. That's going to give us the best shot to getting these kids back by June 1.
From City News, Stephanie.
Hi, Dr. Roussin. I just have a few clarifying questions about childcare from yesterday's announcement. So if school-age children are moved to remote learning, will their siblings still be allowed to attend any kind of preschool childcare, or are the daycares that remain open, are they only for the kids of essential workers?
No, there isn't a change to the childcare centers. So kids that are in childcare right now are still able to access that. And then we still have some of those, public health measures in there. If we start seeing transmission, then we may have to send those to remote as well. But for right now, there isn't a change to the childcare settings.
Okay, so the daycares that are on school property are still allowed to operate?
Yes.
From CHVN, Taylor.
Hi, good afternoon. It's been mentioned earlier that it's not so much the activities that are happening, but what's happening between them that is spreading the virus. How does this speak to how well Manitobans are following the fundamentals?
Well, I think we have to recognize it's really challenging. It's been 15 months, and people want to get back to the things they love. And I think that really is what happened, as we started to loosen those restrictions after very difficult times in November and December and early January. And then it felt like trying to get back to normal. Which certainly we can't fault anyone for, but it is that we try to open up to some lower risk things. Outdoor recreation, is low risk while it's being undertaken, but we just saw so much gathering occur around that. So whether it was carpooling or get-togethers after, or we heard a lot of cases by having sleepovers, and it was justified. Well, they play on the same soccer team, or they're the same cohort at school, or they do this together, so we didn't think it was a big deal. So so I think it's a lot of fatigue there, and I think it's difficult to have trying to get back to some things without that sense of normalcy. So I think we really needed this circuit break to show just how important this is. And we need to decrease those amount of activities, those contacts outside of households, and this is the best way to do that.
Along the same lines, what is public health doing to help people who are fatigued and don't really want to follow the orders anymore?
Well, it's a challenge. So we've tried to have them as least restrictive as we could, right? Because we know that people are tired of this. But really, at this point, public health had to put these measures in place. We're giving messaging. Certainly, there's mental health resources that are available. But it's a challenge. We need to really try to get that message out that it's so important that we try to stop these transmission chains, to reduce the amount of contacts we have out of their households. We see the demands on the ICU right now, so we have to change this trajectory. But at the same time, we can take matters into our own hands as well. We've stopped these transmission cycles in the past. Now, additional thing, we can get vaccinated as soon as we become eligible, and that's really going to be our way out of this.
From the Winnipeg Free Press, Katie.
Good afternoon, Dr. Roussin. With this 3-week circuit breaker strategy for schools, how much of it depends on the student's entire household staying home also?
Well, it certainly depends on everyone following these public health orders as much as possible. If we have these students home and from on remote learning, but they are out and about otherwise gathering with friends, then we're not going to interrupt those transmission chains. So it's really paramount that everyone follow the fundamentals, the public health orders, and the spirit of these. I think everyone understands the spirit of these is that we need to reduce the amount of contacts that are outside your household. And so that includes, gathering outdoors with a lot of people. Without distancing or without masks, we can see transmission there. Certainly it's lower risk. But right now we need to do everything we can to limit the amount of contacts we have outside our household.
Okay. I'm also wondering, you mentioned that you're looking at releasing the provincial modeling data now. Can you explain why that hasn't been previously released and what's changed?
Well, I think we have released modeling data before, and we often just speak. We speak on the trends and speak on our concerns with it. So this is why we implemented a couple sets of increasing restrictions, because as we were describing to Manitobans, our trends were in the wrong direction. We were seeing increasing demands on healthcare systems. So that's what the modeling shows. And so I think we will try to get a presentation together to show it, but what does it show? It shows that our trend's in the wrong direction, that we needed to act, and that without changing our behaviors right now, we're going to see increasing cases and increasing demands on the healthcare system.
From Global News, Will.
Good afternoon, Dr. Roussin. I'd like to talk about contact tracing now. Can you just give us an update on the state of our contact tracing system? And based on your modeling, we're all seeing the numbers climbing here. Are we on track to eclipse our capacity at any point?
So right now, our contact tracing is still within our targets, and we did a lot of work to be able to expand that. So as of right now, we're not at risk of overcoming our abilities to contact trace. We just have to remember that when we see widespread community-based transmission, we're starting to see 500 cases a day, the benefits of contact tracing are diminished. Contact tracing is very useful when we're seeing limited spread and we can interrupt transmission chains that way. Right now, when we have 500 cases in a day with a lot of community transmission, Most of the cases that we're identifying, we can't link to other cases, so we have has a diminishing value. So certainly valuable, and we're going to do whatever we can to continue to be able to meet our targets. But remember, this is why we need to institute these public health measures, because contact tracing alone, when you have this much community transmission, won't be able to reverse it.
Okay, thanks. And hoping you can shed some light on the vaccine topic for us. Vaccine eligibility keeps dropping, and we're wondering, is this due partly to people avoiding or simply not making appointments at pop-up sites? I've heard it's very, very easy to get an appointment at a pop-up site that can be made very quickly. I'm just wondering if that means they're not very busy.
You know, I think we'd better ask the vaccine task force on those specifics. What I'd say is that certainly we've seen increasing supply, which is driving some of this, and so the big message is, if you're eligible, call as the day you become eligible, and get in as quick as you can. This is the best way that we can protect ourselves, the people around us, and really it's our way out of these restrictions.
Our final reporter this afternoon from CBC National News, Cameron.
Hi, Dr. Roussin. I know these things are fluid, and the modeling is constantly evolving. But I'm just wondering, on these current restrictions, May 30th is the date that's been thrown out there. How committed are you to seeing it through to that date, or is there a variable that you see? And I mean, if our case numbers are still over 500 a week from now, do we consider even tougher restrictions? What I'm asking in a roundabout way here is, do you need to see that whole 2-week cycle go by, or are you prepared to do something more drastic soon?
Yeah, and so we've never taken anything off the table. I mean, I think these are, fairly restrictive orders. And so I do think that this is going to allow Manitobans to reduce the amount of contacts they have, and we're going to see those numbers come down. The timing of that is difficult. We've added another variable in, a positive variable this time with vaccinations, so we'll have to see how that goes. But of course, we're not going to take anything off the table if we're required to act further. Then we're going to do what we need to protect the health of Manitobans.
And further, I believe it was Jeff who asked this, and just going to follow up on that too. I think a lot of people do have the mindset that we're back into the same situation as the second wave here, and that took 3 months, almost 4 months to really get through that. What's giving you optimism right now? Like, is there something that you see in the vaccination rates? Is there something you see in another jurisdiction that you can point to and say, okay, this is what's different now?
So we've got a couple things that are different, and vaccines certainly is the biggest one. And so the trend right now, what we're seeing there is this decline in cases, and certainly in severe cases in those older age groups. If you look at wave 2, the amount of 70 and 80 plus that we would see in hospital, it was quite significant, and we've seen a significant trend away from that now. And it's because those people are very likely because those people have been vaccinated and have that protection. So I think there's lots of reasons to be optimistic about the effect of vaccines, but we're still many weeks away from getting into the protection and coverage in the really younger groups in the 20s and 30s, where we're seeing the most cases right now. So we are in that race. But I do think the vaccine's proving to be effective, and that is our way out of this.
Thank you, Doctor. This concludes our media briefing.